It has gotten to the point that when we are sick, hurting, or in need of medical testing, we usually have an inner dialogue of, should I go to the doctor? Usually, it is not a matter of, is this a big enough deal to go to the doctor, but is this a big enough deal to spend money to go to the doctor? College students remain the largest cohort of Americans without insurance. This equates to 1,680,855 uninsured students in 2016. However, while more and more people are getting insured, with the way that the American healthcare system is set up, people are still finding it difficult to budget the extra copays and medical expenses into their already expensive college experience. This is resulting in many people who need medical help to hesitate before going to the doctor. There are also others who are putting themselves under financial stress paying for different medical services. If students are not at their healthiest state, it makes possible success so much more difficult to achieve. However, so many of these people do not know about some of the free medical resources available for them in Jonesboro and even just on campus. I was introduced to this problem long before I knew it was a problem at all. During my freshman year of college, one of my friends was afraid that she might have contracted an STD and wanted to get tested. She did not have a job and did not have a lot of money. With not having a doctor here or wanting to tell her parents, but not getting tested was not an option. She had heard from different people that STD testing could be around $60, which she did not have at the time. She did some research and found out that the Craighead County Health Unit did free STD testing, which she decided to do. While she was there, she received many different helpful medical tips and was even able to get prescribed to birth control and get it free from the clinic. Through this experience, I learned about all the different free medical services that the clinic offered. I decided to look more into different resources that I could get for free, which led me to learn about the Student Health Center on campus. I realized that many people were unaware of these two great services unless they were researching or happened to stumble across it. There are people who are not getting very important medical services such as STD screenings, flu shots, pregnancy tests, and physical examinations, and so much more because they believe they do not have the money to take care of themselves. This is important to me because I have been in the position where I might not have the money or resources for medical attention I really need, but I have been able to get prescribed the medications I truly need to help keep myself in the best health. I have made countless trips to both facilities, and it has truly been a life-changing experience here in Jonesboro. I decided to ask some of my peers how much they really knew about their resources here in Jonesboro.
Yes, I definitely have.
Yes, definitely. Most of the time I just ignore it or I don't know, don't really pay attention to it because the copay is super inconvenient because it's expensive.
Yes, because I'm in college and stuff, and I don't want to spend, money when I'm already broke.
I don't really know anything about them. I don't even think I know where they're at or how we would even pay for it.
I know that there's a student health center and then the urgent care right beside it, and you have to make an appointment for the student health center but not for the urgent care.
Well, I know about the student health center, or it's taken over by NYIT now, but I've only gone there to get my TB skin test done. I've never gone there because I was sick or anything.
Once again, I do not know anything about that.
I know that if you don't have insurance that they'll still take you.
Oh, I know that you can get your flu shots and free stuff there. That's about it though.
According to Diverse Education, more than 70% of college students and recent graduates reported having difficulty finding affordable insurance coverage, which causes much of this population to be uninsured or having poor coverage that doesn't meet medical needs. 1 in 4 Americans have to refuse medical care because they can't afford it. College students will often replace much-needed medical attention with temporary solutions like pain medications. According to the Peter G. Peterson Foundation, the United States has one of the highest costs of healthcare in the world, and healthcare costs have increased dramatically over the past few decades. Some of the key players in the problem are the healthcare systems, the government, and medical facilities. The way that healthcare systems are set up in the United States, it makes individuals believe that anytime they need anything medical related, that will cost money that they do not have. This makes people weary of looking for solutions to their medical problems. However, these free medical facilities also do not advertise well enough to reach all of the audiences, especially here on Arkansas State. Arkansas State offers a free flu shot to students every year, one day a year, but this could be viewed as a band-aid solution because sometimes many people cannot make the certain day for the free flu shot, and afterwards, people do not have any other knowledge of any other resources in Jonesboro. To solve this problem, I knew I needed to find an adaptive solution. For my solution, some of the key players of collaboration is the Student Health Center, along with the Craighead County Health Unit, in collaboration with the students. My solution for this social issue would be to collaborate with the Student Health Center and the Craighead County Health Unit to set up monthly health fairs in the student union, each focusing on another service that each of the different places provide. During these health fairs, each will bring different free items that are usually given out at these different establishments that we put into baskets to give away, which could include condoms, vitamins, and other items that would give people a better insight on what they can get at these facilities. Along with these baskets, people would also receive an informative pamphlet listing all of the free services both places have to offer. This pamphlet would also include the physical addresses and the contact information. This will be a helpful tool for students to refer to. We could reach out to local businesses around Jonesboro for fundraising of the cost of the health fair and all the materials covered in making it happen. Along with this, we could put some of the fundraising towards building an on-campus pharmacy to make necessary medications more accessible to students on campus, especially students who do not have the means to travel off campus to a pharmacy. We could do this by partnering with NYIT and the College of Osteopathic Medicine. When thinking about this project, I had to reflect over the 7 C's of change. When examining my consciousness of self, I reflected over what the community I was a part of really lacked and what I was passionate about. I thought about the career that I wanted to enter into, the medical field, and the importance of healthcare being available to everyone. I weighed what was important to me along with what I thought our society needed. When thinking of my options, I wanted to choose something I'd be passionate about and would stay true to. I definitely feel like this is an issue that is important to me. This project would require a lot of commitment because the medical fair would require a lot of hard work from many different sides of the project. People would need to make sure that the tasks that are required are completed. With this project, there will be many different people working together, which means that there will be a lot of different opinions and ideas. We will have to make sure that everyone's opinion and idea is heard. This idea is based off collaboration. We will not only be collaborating with the Student Health Center, but with the Craighead County Health Unit. This will require them to also collaborate with the students to have volunteers to work the health fair. The common purpose of this project and all of these medical facilities is for better health for everyone in Jonesboro, especially the students here on the Arkansas State campus. This project is supposed to help benefit the citizens of Jonesboro, Arkansas, as well as the students of Arkansas State University. This project is essentially citizens helping citizens. It's our duty as members of this community to make sure that we are keeping each other in the best health. I believe that good health should not be something that needs to be bought. I believe that there should be better health for everyone. I envision a future where any student on the Arkansas State campus or a citizen in Jonesboro, Arkansas will be able to go to the doctor whenever they feel sick or unwell. I envision a future that is happier and healthier.